Namaskar. I am Dr. Sanjay Gupta. I am the head of the Department of Tuberculosis and Respiratory Disease at the National Institute of Tuberculosis and Respiratory Diseases, New Delhi. So, the technology has significantly advanced the diagnosis of and treatment of tuberculosis in the recent years, especially through the use of artificial intelligence and the mobile health apps. Some of these improvements include the diagnosis using the artificial intelligence, AI, and the machine learning algorithms. They have been used. They have been used to analyze the chest X-ray and the other imaging data like CT scan, MRI, etc. for improving the accuracy and the speed of the TB diagnosis. For instance, the computer-aided detection softwares, they are called CAD softwares, they can interpret the digital chest X-rays to identify TB more effectively. Then there are mobile apps, mobile health apps, which can be used for monitoring the cough pattern using the smartphone sensors, providing healthcare providers with real-time data to diagnose TB and monitor the treatment effectively. Then there are AI-powered digital stethoscopes which can detect the TB by analyzing the lung sounds. The doctors, they can hear the lung sounds over the chest and making it easier for the doctors to diagnose TB even in remote areas. Cough monitoring mobile apps, they can track the cough frequency, severity of the cough, and helping the doctors and the other healthcare providers to assess the progress of the TB treatments. Then these mobile apps and the AI tools, they are particularly beneficial in the low resource settings where access to the healthcare facilities is limited. These technologies help to bridge the gap by providing the diagnostics and the monitoring tool which can be used in the community. Then these AI and the machine learning algorithms, they have been used to predict the drug resistance by analyzing the genetic data from the TB bacteria, helping the physicians to choose the most effective treatment regimes. So these are some of the technological advances which have been crucial, which have made the fight against the TB more effective and healthcare more accessible. The rural healthcare providers face several challenges and their solutions are also there. One of the major challenges, the limited infrastructure, that is issue of connectivity and issue of power supply. In many rural areas, the internet connectivity is not reliable and even the mobile coverage area, network coverage area is less. Further, in some of the remote areas, the inconsistent electrical supply can affect the functionality of the digital devices. Then there are technical difficulties related to device malfunctions, digital technologies like use of smart pillboxes. They can experience the technical issues. Then there can be lack of necessary skills of the healthcare providers in the rural areas to use these digital tools. Further, there can be some constraints like financial constraints and the human resource constraints in the rural areas. Like there may be some limited funding for purchase and maintaining the digital tools, and there can be shortage of trained healthcare workers to manage and support the use of digital tools. Then there is an issue of acceptance and trust among the patients and the providers to adopt the new technologies due to lack of this trust and understanding. and lastly, there can be issues, concerns about the data privacy and security, which may deter the user using the digital health tools. The solution would be to enhance the connectivity, internet connectivity, mobile coverage area, improve the power supply, yes, and for the healthcare workers, plan the training programs for use of these newer technologies, newer digital tools. There can be, like I said, there are financial barriers, so more funding is required, and for the human resource, more technical persons are needed to be recruited in the rural areas. Awareness campaigns can be held for the patients and for the community for adopting these digital tools, and obviously building the trust by involving the community leaders can be very helpful. So addressing these challenges requires a multifaceted approach, including involving the infrastructure development, technical support, resource allocation, and community engagement. By tackling these issues, the rural healthcare providers can more effectively use the digital tools. Some of the advanced diagnostics, which may be more rapid and point of care tests, are under development. They should be inexpensive, accurate, and rapid, and we should be able to use them at the point of care. So these tests aims to provide quick results, making it quicker to diagnose the tuberculosis in the remote areas and in the resource limited settings. Further, improvement in the AI-powered imaging, for analyzing the chest X-rays and the other imaging modalities with higher speeds and with higher accuracy is required. Then, development of new shorter treatment regime. Currently, the treatment regimes, they can be from 6 months to up to 1.5 years to 2 years in some of the drug-resistant cases. So, need for development of shorter treatment courses which are more effective. They should be developed. In this, the personalized treatment regimes can also be given using the genetic and the molecular data to tailor the treatment plans to the individual patients. Then the development of new generation vaccines. Many of these vaccines are in the pipeline, which aim to prevent the TB infection and transition from latent TB to the active TB. So these vaccines can significantly reduce the incidence of TB globally. Then in the digital mobile apps, development of mobile apps, there is requirement for development of more mobile apps for the monitoring the treatment adherence and tracking symptoms, providing the educational resources to the patient. Then there is a role of telemedicine, expanding the telemedicine services to provide consultation to the patient in the remote areas is of immense importance. Then genomic sequencing, the advanced genomic tools to detect the drug resistance and guide the treatment decisions. So they are under development, and these can greatly help in managing the multi-drug resistant TB or the XDR TB cases more effective. Further, some of the biomarkers, they are under pipeline, and they can be developed for early detection and monitoring of the TB treatment. Then some public health innovations, including the integrated care models and the community-based approaches, should be developed. So all these innovations, they hold great potential to revolutionize the TB care, making it more efficient, accessible, and effective. Why the patient should adopt these digital solutions? Because they help them to connect to with their healthcare teams by for regular monitoring of their health, their progress in real time, ensuring that the patient receives the full treatment and the timely support whenever it is required. Then telemedicine, use of telemedicine, as I said, can help greatly, uh, and it can give easy communication with the concerned doctors and the other healthcare workers. Then these tools, they help the patients for their treatment adherence by giving them reminders, by giving them alerts that okay, this is the time that they have to take the medication. Similarly, then educational resources can be there on the mobile apps, which help the patients to gain more and more information about their disease. Further, support networks can be there, online communities and support groups are there for TB, and they can be very helpful for the TB patients for completing their treatment and overcoming the social stigma related to this disease. Further, the patients can empower themselves for tracking their health and for personalized care through these tools. So, lastly, I would say that remember, using the digital tools is about enhancing your treatment experience and making it as smooth and effective as possible. Don't hesitate to ask your healthcare provider about the digital solutions available to you and how they can support your journey to recovery. Thank you very much.